امشب یکی از دوستای خیلی خوب و واقعا یک کامیونیتی اکتیویست خیلی فعال ما آوردیم برای شما. مزدک حدایق واقعا یک کامیونیتی اکتیویستی بوده، برای چندین سال من خودم شخصا باش کار کردم. واقعا یه فرد شایسته و دانا در خیلی موردهای عمومی هستش، اما در این مورد امشب دلیلی که ما برنامه رو با شما تهیه دیدیم در امور هلت کیر سیستم، امور بهداشتی آمریکا مزدک صحبت میکنه. بایوگرافی و بک‌گراند مزدک تو ایمیلی بود که پخش شد، اما مزدک کار اصلیش تو کوالکام هستش، یه مهندسه و به خودش گرفته که امور بهداشتی آمریکا رو بهش آشنایی پیدا کنه و تمام کمبودیا و آوانسایی که تو این سیستم خودش بررسی کرده به نظر شما بیاره و بتونه سوالای شما رو جواب بده. این قسمت برنامه به انگلیسی پخش میشه، اما هر سوالی که شما داشته باشین میتونین به ما بفرستین و با کمک همکارامون ما به نظر مزدک میرسونیم و تمام سوالاتون رو جواب میدیم. در صورت من خیلی خوشحالم و افتخار میکنم به معرفی دوستم مزدک حدایق. مزدک جان.
خیلی ممنون شهریار جان، واقعا دست درد نکنه. باید ببخشی که من فارسیم به خوبی فارسی شما نیست و البته تا اونجایی که میتونم سعی میکنم سوالا رو به فارسی بپذیرم و اگه تونستم حتی جواب بدم، ولی این بحث ما امشب یک کمی فنیه و اگه اجازه بدین من اینو به انگلیسی بگم. Thank you very much for this opportunity. I started volunteering as a healthcare activist a few years ago, just in part out of a need to do community service and just understanding this idea that healthcare seems to be a big problem in our nation. And over time, I started accumulating more and more knowledge and did my own research and found increasingly that the case for single-payer healthcare is just so compelling. And I'd like to share some of my findings with you. So let me go ahead and share my screen here. Give me 1 second here. Okay, and maybe Shahriar John, if you can give me a indication that you can see my presentation. Okay, excellent. خیلی ممنون. All right, let me just dive right in. So the U.S. healthcare system represents a $3.6 trillion industry. As a share of the GDP, the US stands in a class of its own. It's at 17%, far above, not just in amount, but as a percentage, far above and away from our nearest competitors. Switzerland is the second in that league. They spend about 12% of their GDP on healthcare. And most of our international peers, the nearest international peers, are in the order of 10%. We also spend about 2 times per capita than our nearest comparable countries in healthcare. It is often among the top issues on voters' minds, not just in the last election, but in many elections in the past. And the other distinction that the US healthcare system has is that it's the only high-income country in the world not to guarantee healthcare as a right to all its citizens. So some of the sort of high-level metrics that many of you may already be familiar with is that we have 29 million uninsured in this country, and that's pre-pandemic. That number has increased quite a bit since then. The official numbers are not out yet. That represents about 11% of the non-elderly population. People over 65 generally have Medicare, and therefore the uninsured rate amongst them, while it's not zero, it's much lower. We have, by the most conservative estimate, 40 million underinsured. These are people who have health insurance but cannot afford their out-of-pocket expenses. We also have 500,000 medical-related bankruptcies per year, something that is unheard of in the advanced world. People often don't even understand what that means. And it's important to pause on that number, because 500,000, it doesn't mean 500, doesn't affect just 500,000 people, right? This is, oftentimes these people have families, they have kids. And so when they declare bankruptcy, it has a ripple effect across their families and their loved ones. And, you know, even right down to the person that they have to pay rent to, it could affect them because they have to pay so much in medical bills, they may have to skip their rent. It's also one of the leading causes of homelessness. There were 68,000 avoidable deaths per year due to healthcare access or affordability issues, again, pre-pandemic. And about 1/3 of COVID-19 deaths in the US were attributable to lack of healthcare insurance. So now we're talking on obviously in a unusual year, 2020, that number is closer to 200,000 in just COVID-related deaths on top of the regular deaths. So why should we care about the system? I mean, many of you may be listening in and thinking, well, you know, I have a stable job. My employer gives me really great healthcare. Why should I care? Well, oftentimes what I found is people don't fully realize how bad our system is until they have to actually use it, until they have a denial by a private insurance company for a procedure that they might need. Many of you may have experienced this in the last 5 to 10 years, that if you do happen to have an employer-sponsored healthcare plan, which is most of us, that the out-of-pocket or the deductibles have been increasing quite a bit. You may be in a comfortable position right now, but anybody can experience a job loss. Things might be fine for the moment, but many of us have been here for 10, 20, or 30 years, know that there are ups and downs in the economy, and you can be the best, most loyal worker, but you could still lose your job. So then you're at the whims of going in the open market to purchase your healthcare insurance. And those who have done this often find that it's extremely expensive. You may be wanting to start your own startup or joining a startup. What you'll find is that companies that are smaller are unable to negotiate, don't have the negotiating power to come up with a good insurance or competitive healthcare plan for their employees, at least affordably. So you may think twice about going to a startup where you might be doing, you might have a bright mind, you might want to do some innovation, but you may also have some healthcare issues of your own, and that disruption is non-trivial for many people. Another example is you might go through a divorce, God forbid, and maybe you receive your healthcare through a spouse. Maybe you're not working currently, maybe you're a caretaker, and after a divorce, you are pretty much in the wild trying to find insurance, and again, we'll find that it's quite expensive. Small business owners will probably have seen this, especially those who have to compete with larger business. Larger businesses have the scale to be able to come up with a reasonably priced, and this is very relatively speaking here, the premiums for their employees. They can, when they have a large pool of employees, large business can negotiate better rates. Small businesses are at a huge competitive disadvantage. In fact, many of them end up not offering healthcare insurance to their employees because they're not required to. The current law requires businesses over 50 employees or above to provide insurance for their employees. If you are 65 and over and you're hopefully on Medicare, that's probably the best place as far as our healthcare system is. You're probably treated the best. And even in that category, you may still experience some deficiencies with our system, namely that you have to purchase a supplemental insurance that often its rate goes up from year to year, sometimes pretty dramatically, and same with prescription drug coverage is often on the rise. So we have the most expensive healthcare by a long shot than any of our peers, but surely that must mean we have great outcomes. Well, that's simply not the case either. In fact, we rank below 30 for most of the prominent healthcare rankings that are in the world, based on a variety of metrics, health metrics. And I've just picked on a few here in this slide. Some of the ones that I thought were the most telling. Life expectancy, you can see the US is way down here, and all our competitive, these are, again, high income countries where we compete. Oftentimes, some of them have lower income than we do. They not only have a significantly higher life expectancy, but that rate is actually still climbing. In the case of the US, you can see in the last 10 years, it's actually flattened out. And in fact, the last couple of years, we've even seen years of decline. Child mortality, same thing. One of the highest rates of child mortality amongst advanced economies. In the case of maternal mortality, it's just shamefully like we're in a league of our own. We're 2 times as high as our nearest competitor, and far more than the others. Just to kind of level set, this is what our current healthcare system looks like. So the pie chart here shows you the number of people who get their insurance through various means here. You can see the biggest share of the pie is employer-provided healthcare. And we have Medicare for people over 65, as I mentioned, Medicaid for people people who are low income, and that's defined by if they make 138% of the federal poverty level or less. And the federal poverty level for an individual is $12,760 per year. So it's a very small amount, especially if you live in California. That number, you can see the share of Medicaid has grown quite a bit over the last 10 years. If we saw this graph maybe 10 years ago, it would have been a lot smaller. That's thanks to the ACA expansion for the neediest of the people in our society. And I'll speak a little more to that. And then there's military. This is important. I only mention this because while it's a small percentage, it's actually 1, maybe 2% now. It's interesting because it is government funded and government run. So VA hospitals are government entities, and VA doctors are employees of the government. So it's an interesting data point for you to observe, because socialized medicine, as it's commonly known, does exist in the US. It just happens to be in the VA. Private funded insurance, the so-called non-group, essentially refers to anyone who's not getting their healthcare through an employer. So they're sort of on their own. And thanks to the ACA, we now have healthcare exchanges where you can purchase your own healthcare. But as you can see in this graph, it's only about 6% of the US. And even that 6%, it's not all healthcare exchanges. You can theoretically still buy insurance in the open market outside of those exchanges. Employer-based, I already spoken about. And then you, of course, have the uninsured. 9% still remain uninsured. So the Affordable Care Act was in large part enacted about 10 years ago, also known as Obamacare, to remedy some of the problems with our healthcare system, when insurance companies could essentially discriminate against anyone who had pre-existing conditions. They could essentially pick and choose their customers and say, you're too expensive, I'm not going to insure you. They had every right to do that, or at least charge you a lot more for that. The ACA got rid of that, so that was a very big plus. The ACA also enacted the individual mandate, where everyone is required to purchase health insurance. And that was obviously good and bad, because a lot of people don't want to be told that they need to buy insurance, and it obviously costs money. And if you can't afford it, you're going to be fined for not having healthcare insurance. Now, that mandate has since softened under Trump. Trump got rid of it, but many states came back and enacted their own, including California. California still has an individual mandate. And then there's the Medicaid expansion, which I already mentioned, and the healthcare exchanges, which represent that 6% of the pie, is where you can buy healthcare insurance, and they're reasonably regulated. But what you'll quickly find is that many of those plans are very expensive, unless you make 400% or less of the federal poverty level. And these exchanges are not uniform throughout the US. So this is maybe California, where it probably works the best, or is one of the best. Again, if you live in a place like San Diego, where it's pretty expensive, if you live in a big city, in pretty much any big city in California, you're going to find that to qualify for those subsidies, you actually have to be, you can't have too much income to qualify for those subsidies. And it's a sliding scale, so you don't get too much subsidy if you're close to that level. The ACA did some good things and some bad things, but its central failure is that it's simply not affordable, in spite of its name. As you can see in the graph here, the cost of healthcare has far outpaced workers' earnings and overall inflation, whether you're looking at family premiums, whether you're looking at deductibles. And in fact, you might be looking at this graph and thinking, well, at least it's leveling off. Well, I'm sad to tell you that 2020 was a very special year, and everybody avoided the doctor like the plague. And so actually, insurance companies didn't have to pay out that much because people didn't go to the doctor. In fact, many doctors had to close their shops, or many could not accept patients for stretches out of the year. So it's an anomaly. And in fact, with all the people who have postponed their care, I have every expectation that 2021 will shoot right back up. So what can we do about our healthcare system? What are some of the proposals? What are some of the top proposals that are being mentioned here? And by no means this is an exhaustive list, but I just wanted to touch on the big ones. So there's a large segment of our political sphere that is pushing for a return to pre-ACA system. I mean, some of you probably saw that under the last 4 years, where they tried to basically overturn the ACA. And actually, that fight is not done yet. There's still a court case going on, and the ACA may still get overturned with a 6-3 Supreme Court majority, Republican majority. I don't want to spend too much time on this because largely this is not really a proposal. This is more of a, let's go back to the old Wild Wild West, where we had 45 to, close to 50 million uninsured. And like I said, insurance companies could discriminate and pick and choose who they wanted. So we're not going to spend much time because we know what that world looked like. The most popular one that you hear about on the mainstream news is shoring up the ACA. And in fact, that's the direction that we're largely going into. So I'll touch upon that. The other thing that you might hear a lot about, President Biden ran on this, adding a public option, but has since backtracked on that. And although anyone who's following this as closely as I have been was not even 1% surprised by that. But I will talk about what the public option is. And then finally, I'll talk about single-payer healthcare, which is obviously the subject of my activism and where I think we need to go. So shoring up the ACA, that essentially requires us, taxpayers, to subsidize and make healthcare more affordable in order to have fewer uninsured people. We're already subsidizing people who can't pay. The problem is we're subsidizing it at the most expensive way possible. So every insurance company, when we have the insurance company in the middle of the system, remember that they are corporations, and corporations by design have to maximize profit. They have a fiduciary duty to their shareholders to maximize profit. Every one of us has to do that. Every one of us has to subsidize those shareholders. So that's one problem with it. It's saddled with profits. It has marketing costs, and it also has really high executive pay. So if you just understand that basic premise that the empirical data clearly shows that health insurance, the Affordable Care Act, has not done anything to control costs. In fact, it has accelerated the cost increase. Why would you want to double down on a system that simply just guarantees more profit at our expense, at taxpayer expense? And that's the key. So let's talk a little bit about the public option, which I know sounds very attractive. The problem with the public option is that it keeps our same multiplayer. Now, our multiplayer system, it's not just that it's a multiplayer system. There's nothing particularly wrong with a multiplayer system in and of itself. Our system is just really, really fragmented. If you look at the pie chart that I have, and then take into account the fact that in the private sphere, you have multiple private insurance companies. Each of them are an entity that go and negotiate prices with different healthcare providers. What the public option will do is it will just introduce one more payer into the system and make it more complicated. The impact of that is that you have more administrative overhead. The system, people you have to hire to handle very complicated billing. And it also doesn't increase the ability to negotiate prices. So when you have one more payer, that one more payer doesn't necessarily have any better way to negotiate. The other problem with the public option is that, well, private insurance companies are not stupid. They're smart. They're going to figure out how to retain the healthiest customers and leave the sickest ones to the taxpayer-funded public option. They can do this very legally by simply depleting their networks of things like cancer treatment. It's not that they won't have any cancer facilities. They will have them, but they just won't have enough of them. And anyone who needs cancer treatment will just opt to the public option, where it's more complete and more regulated. Over time, that pool will get more and more expensive when you have more sick people in that pool. And then it will just open up to even more political attack, where people will say, see, the government cannot solve any problems. It's just too expensive. And then meanwhile, the private companies will keep inexpensive plans in place and make their plans very affordable. So, and it also doesn't solve the affordability problem, because unless it's free, unless it's there are no premiums and no out-of-pocket expenses, only then can you really address the affordability problem. The only exception I would make to the public option is if the public option ends up being Medicare itself, which has a proven track record of working, and I'll touch upon that a little more later. What is single-payer healthcare? Essentially, single-payer healthcare is this idea of having a single-payer pay the system. So in other words, there's only one payee into the system, one grand negotiation that happens with private providers. But what's really key to understand is that it's publicly financed but privately administered. And that's the key word, the second part. It's privately administered. So it is not a government takeover of healthcare. All right, so let me elaborate a little more about what the current legislations that are out there will do. They essentially holistically address the deficiencies of our system. They really do this in two directions. They not only say everyone is automatically covered, they also expand what Medicare currently is. So currently Medicare, there's original Medicare and there's Medicare Advantage, there's little differences in there. But the key thing is that you still have to buy supplemental insurance. Oftentimes, you have to have a separate drug prescription coverage. And even then, you still have to pay some out of pocket. Well, this will get rid of all that. And also, Medicare today does not cover dental care, vision, and hearing might be kind of partial. But in general, it doesn't cover all those things. So this is really basically acknowledges that at any point in our lives where we all need health needs, those needs change from year to year. So let's create the biggest pool possible, negotiate the best rates possible, and move on with our lives, essentially. So that's what that is. So if we're gonna cover everybody, and we're gonna improve the coverage. And by the way, I didn't mention this, but give people more choice. This is very important. With Medicare, with original Medicare, you can go almost any doctor you wish because Medicare is the most universally accepted form of insurance by doctors and hospitals. So whereas people under private insurance often are constrained by networks, and I'll touch upon that a little later. So if we're going to cover everybody and we're going to increase the coverage, and surely it must cost more. But study after study after study have shown that Medicare for All would actually save somewhere between $2 to $5 trillion over a decade compared to our current system. Now, this might be shocking for some, and I'll talk about how or why this is. But what's interesting about this is that even some of the most conservative actors, I'm speaking specifically about the Mercatus Center, which is a Koch brothers funded think tank, not a friend of socialism, not a friend of collectivism. Even they concluded that Medicare for All would save $2 trillion. Now, of course, they commissioned that study thinking that they would disprove this, that they would basically push off Medicare for All. But their study, which was authored by a George W. Bush economist, proved the opposite. It proved under the most conservative set of assumptions, it would still save $2 trillion over our current system over a decade. And even if that's not convincing enough, the CBO, which is the Congressional Budget Office, which is basically an arm of Congress that scores the financial impact of legislation, concluded just this last December that Medicare for All would save $42 to $743 billion per year. All right, so how does it do this? You might be thinking. Well, Medicare for All significantly reduces administrative overhead. By some estimate, we currently spend something close to $500 billion in administrative overhead. These are people who are administrating our system, people on the provider side, people on the insurance side, who have to navigate this very complicated system that we have in place, constantly renegotiating year from year. And by the way, you can also add employers to this as well. Big companies have to hire staff to administer their benefits. That doesn't come for free. Medicare, I've touched upon this already. Medicare for All would give a negotiating power. I mean, it's basic. If you understand economics, you understand the idea of a monopoly, and monopoly can dictate prices. And monopsony is one where you're the only buyer of a good or a service. So therefore, you have the most leverage in negotiating prices. Number three, it simplifies hospital funding by doing them through a global budget system. This gets a little wonky, so for those of you who are interested, we can talk about that. It basically cuts even further on administrative costs. And the other thing that it does, by having everyone automatically covered, you're essentially creating an environment, finally, where people can seek preventative care, which is the least expensive kind of care you can get, versus our current system, which incentivizes emergency care, which is the most expensive care. Just as a data point, since medical costs have been going up in general, you can see in comparison to Medicare, how private health insurance has been doing. You can see this gap is growing. This is, by the way, on a per enrollee basis. So Medicare, which has to provide healthcare, or not provide, but ensures the most vulnerable in our societies, those 65 and over, those who have the most need for care. Medicare has been able to maintain the costs low. And this here is Medicaid. Medicaid has done an even better job, but the problem with Medicaid is that, as many doctors will point out, its reimbursement is insufficient oftentimes. That's why many doctors don't even accept Medicaid. And it's really reserved to the neediest in our population. Other reasons to support Medicare for all or single payer healthcare is it basically creates a level playing field for small business. As I mentioned, you can see 100% of businesses over 50 employees provide health insurance. That is true. That's because the Obamacare made them. But small business over time has gone from 30% of them providing healthcare insurance and gradually going down. And even those that do provide it oftentimes have less competitive plans. So this doesn't really promote entrepreneurship, doesn't promote innovation. It's actually the opposite. Medicare for all, as I mentioned, provides the most choice, the most freedom for you to go to any doctor you wish. Under a Medicare for all plan, you could go to any doctor you wish. There's not going to be a insurance company standing in your way telling you what you can or cannot do. Remember that if you're getting your insurance from an employer, you never chose your insurance company, right? Your employer chose it for you. And that insurance company restricts you by a certain network. You might be limited to Scripps. You might be limited to UCSD. So that's further constraining your choice. And then even after all that's said and done, an insurance company can still deny you care. They can say, they may even sometimes overrule your doctor and say, no, we can't, we won't approve this procedure. You should try some other procedure that's less expensive. Medicare for all is very simple, and it already exists. The original Medicare was put into effect 1 year after it was signed into law using 1960s technology, and the proposals that are out there for Medicare for all call for an orderly transition of 2 to 4 years into the new system. So it's not like this will happen overnight. Medicare for all will also promote health equity, which is a huge problem in our society. With COVID, we saw the deaths among people of color 1.2 to 3.6 times that of whites. And you can also see the uninsured rate here. Vast disparities still exist among Hispanics and Blacks compared to whites. And this is after all the gains of the ACA. So why now? Well, if the case for employment or for your healthcare being tied to your employment was not already obvious as a bad idea, the pandemic certainly exacerbated this problem, because when we lost millions of jobs, and we lost about 10 million jobs net by the end of 2020, we actually lost more than that during the year. So many of those people got thrown off their insurance plans at a time where they needed it the most, at a time where they could least afford to get their own insurance. More and more people are getting pushed to gig work. This is to some degree a worldwide trend. It's certainly a US trend. And in our very own state, right here in California, we, the voters, thanks to all the spending that Uber and Lyft and all the gig companies did, we ended up approving Prop 22, which makes it much easier for people to be classified as contractors, which deprives them of health insurance. And many of those people don't make enough to buy health insurance on their own. So this is a trend that's going to continue, and we're essentially being used as a template for the rest of the country. So I personally have nothing against gig work. I just think that we should provide a safety net to those people. They should have healthcare. Democrats, as most of you know, currently control the House, the Senate, and the presidency. So the time to act is now. This is not an opportunity that happens all the time. There's a very short window. And finally, Medicare for All is a winning political strategy. Recent polls, and actually this has been pretty consistent, show 69% support among all Americans, including a whopping 46% among Republicans. Those numbers have held pretty steady over the last 2 years. And then I'll just bring it down to the legislation that's out there. It's called HR 1976. It was unveiled in the middle of March and currently has 116 co-sponsors amongst Democrats, not a single Republican. By the way, Republicans also never supported, not a single Republican supported the ACA, so it's not unprecedented for this to be pushed by only one party. And you can see amongst the San Diego delegation, 3 years ago, this picture looked a lot different, but year by year, each representative, whether they were new or they were there from before, became co-sponsors of this legislation. The only Democratic one left is Scott Peters, who's been the subject of much of my and my peers' activism. And of course, Darrell Issa, who is a Republican. And if you want to understand better why some politicians support and some don't, there's an easy way to do this, and that is to go to opensecrets.org, which tracks how much donations they receive, corporate or campaign donations they receive, and you can actually see where they're coming from. Are they coming from ordinary people who are giving them $20, $50, or are they coming from healthcare PACs, pharmaceutical PACs? And I think you will find your answer pretty quickly. I'd be remiss if I didn't take a couple of minutes just to talk about the role of the media. And part of the reason why I really appreciate having this opportunity to give this talk is that the media really fails us when it comes to this issue. And honestly, it's not the only issue where it fails us, but this is one of the prominent ones. And I'll just touch on a few. So if you're getting your news, or if you're trying to understand how a single payer healthcare or Medicare for all would look like, and if you're relying on any of the sources I've listed here, some of the most prominent sources of media in our country, then I'm sorry to say, but they're just not going to tell you the whole truth. And that's to put it very charitably. So I'll touch on some of the talking points that you'll hear, some of the headlines. Sometimes the articles may be perfectly fine, but the headlines alone completely dismiss it, or just the framing of the issue is just designed to dismiss it. And I'll tell you, and I'll talk about why. So one of the common ones you see is Medicare for all will cost $32 trillion. Obviously, that's a humongous number, but they failed to mention what our current system costs, which is $34 billion by the most generous estimates, and that 2/3 of the money is already being spent publicly anyway. So you would only have to come up with another 1/3. And yes, there will be taxes, and I'm sure that's a subject of questions probably from the audience. And we can talk about that if there are any questions on that. The second one is, I think I touched about that already, but it's socialism. Government take over healthcare. Government can't do anything right. There's variants of this. Well, Medicare for all, as I mentioned, is publicly funded. It's true, but it's privately administered. So if you think about your definition of capitalism and your definition of socialism, you'll see the goods and services are being privately administered, privately delivered. So it doesn't really fit that definition, regardless of what you think of socialism. People like their healthcare. This is a very common trick. People love their healthcare. They don't want change. They conflate this idea of insurance with the provider, which are two different things. Nobody likes their insurance. People may like their doctor. That is true. No one's going to balk at the idea of having more choices to see doctors. So that's another talking point. Overhaul of our healthcare system is too disruptive. Well, as I mentioned, Medicare already exists. It's not a brand new system, and private providers would remain the same. So that would also not be very disruptive. or it's not as disruptive. It will be disruptive to the health insurance industry. And there is, I should say, there is an orderly transition in place which would compensate the workers in those industries, both in terms of retraining as well as salary replacement to the tune of like 5 years. So I've never seen a piece of legislation that's that generous and that responsible when it comes to transitions. And one more other thing I'll mention here is Medicare for All would kill innovation. That's another really popular talking point. The NIH, which is the National Institute of Health, it is taxpayer funded. We fund it to the tune of, I believe, over $40 billion per year. And they do a ton of research for the benefit of the industry. Of many of the drugs that we have been invented, have started with research that we taxpayers have funded through the NIH. And then the pharmaceutical companies take that and build patents around that and create monopolies and end up charging us more money for them. The other thing that you should know is that pharmaceutical companies, at least, and this is probably true with healthcare companies as well, they spend much more, as you can see in this graph in the lower right. The red circles, orange circles, are the sales and marketing budget. This is how much they spend on sales and marketing. And the blue ones are how much they spend on research and development. So it's not that they don't have enough money to innovate. Furthermore, this picture doesn't show you this, but they, of course, have to pay their shareholders. So they do stock buybacks, they do all kinds of tricks to use the profits not to fund innovation, but to enrich shareholders. So, sorry, I had to leave this one as a small joke here, but during the primary season, Fox News had this snap poll thinking that they would dismiss Medicare for All, and their audience overwhelmingly was in favor of government-run healthcare. So I just thought I'd mention that. So I think that more or less concludes my talk. I hope for some of you, I know some of you are probably already supporters of universal healthcare, so this might not be anything new. For those of you who haven't been thinking about this much, I hope you take away one or two things from this. There are things you can do to help further this cause, and I've left my contact information. I'm sure AIP will be able to put you in touch with me if you're interested in volunteering, or I would say if you're sold on this idea of Medicare for All and you want to further that cause, one simple thing you could do is take a look at the petition that we've recently put forth and see if it makes sense to you and consider signing it. That's one way we can bring pressure and try to enact good policy in this country. And with that, I think I'll pause here and open it up to Q&A.
خیلی ممنون ماز. That was fantastic. برای خیلی از ماهایی که به اصطلاح این موضوعای عمومی رو به اصطلاح تحقیق میکنیم، توش فعالیت میکنیم، این یه پرزنتیشن خیلی واضح و کلیر و واقعا چیزی که همه فکر کنم میتونن درک کنن. یه سوالی که تو چت دیدی، حالا I'll say it in English, I think you answered it a little bit. How can ordinary people move legislators towards having a single payer system? Signing the petition is a start. Obviously, writing your congressman or congresswoman is the next step. But let me add to that question. Where is the legislation right now? I mean, even if people write to support a bill, is it the right time? Will it be next year? When is the right political climate for this to get traction?
Yeah, so good question. People who've been doing this long enough, I think have realized that this is really a long game.
Yeah.
And it's really a test of our democracy, really. That's kind of how I view it. I don't necessarily view it as I'm gonna like convert this one politician and my job is done. It's really a long game. So currently, President Biden, during the campaign, he did say that he would veto a Medicare for All proposal, and he echoed some of the industry talking points that about the cost, and it's very clear that he just doesn't know the basics of it, and that's fine. He wouldn't be the first president, but right now, as I said, there's 53% of Democrats are on the record co-sponsoring this. And is that enough to put it up to a vote? I would say no. It would almost certainly fail. But there is a very concerted campaign right now to turn every Democrat district to a supporter. And this district that I live in, District 52, I suspect many of you in this audience are also in that district, is one of those districts. Congressman Peters is one of the top recipients of pharma and healthcare industry dollars, corporate PAC dollars, and he's number 7 in the list. So it's going to be a district by district. There are activists in every district, activists like me, and will it pass in this term? I quite frankly, I'd be lying if I said it would. No, I don't think it would. I think this was probably a great opportunity to have it pass because we have the House, the Senate, and the presidency. But what people are going to do are they're going to keep pushing for candidates who are in favor of Medicare for all and try to, move the ball forward, essentially.
Yeah. حقیقتی هم که هست مثل ACA, Obama made it his signature political accomplishment, right? I mean, به قول ایرانی‌ها فیل هوا کرد, right? he did an impossible thing. اما همونطور که میگی بایدن انقدر پرابلم داره با اقتصاد, COVID, Middle East. I mean, for this thing to raise to the top as to become his signature piece is a very difficult scenario, right? The political reality of it. Yeah. So people may have to be patient to see what happens next year and how they could add to this to the political momentum. But electing 1 or 2 congressmen or congresswomen, and even if they talk in favor of it, getting that number from 53 to 54 to 56, it still may not be enough to make it the priority of the day, given how divisive the Congress is right now.
Yeah, it's a political game. Right. You have to, it's a momentum game, right? So if once you start to you hit a certain threshold and it becomes impossible for people to hide. And part of what I'm trying to do, part of the reason I'm doing this is because people just simply don't have all the facts. Some do, many don't. Right. And a lot of people don't understand what Medicare for All even means. And it's going to become, my goal in life is to make it difficult for people to hide behind the talking points, right? Behind the industry talking points. And to the degree that we can educate people, that's how we move the ball forward. And that's how you get concessions also. So it's not a zero-sum game. It's a continuous spectrum of gains that we can get in the towards achieving essentially healthcare justice.
Right. So آقای سعد به من یادآوری میکنه که این پرزنتیشنت به فارسی ترجمه شده و تو پیک فکر کنم نسخه 193 چاپ شده به فارسی، هم به انگلیسی و هم فارسی. و برای دوستان و هموطنان این که میخواستن یه ذره تمام این برنامه ها رو به فارسی مطالعه کنن، به پیک وبسایت پیک میتونن مراجعه کنن و اون تمام این اکثر فکر کنم تمام این پرزنتیشن رو به فارسی میتونن نگاه کنن.
این سوالا رو من از اینجا بعد بخونم، از تو تکست بخونم اینا رو.
من دارم کوئسشن‌ها رو نگاه میکنم، بعضیشون کامنتن، بعضیشون
Okay. I'll just let you ask the question.
سلام. چون بعضی از سوالات تکست میشه واسمون یا از قبل ایمیل اومده، من همه سوالا رو خدمت آقای مزدک تکست کردم. یعنی مثلا بای دیفالت میتونید هم آقای شهریار سوالا رو بگه، هم سوالایی که تو سوال آقای شهریار نبودن و مزدک میتونه بخونه و جوابشون رو بگه. دست شما در نکنه.
مرسی.
سوماز اگه میخوای تکستاتو اگه میخوای نگاه کنی
الان اگه نگاهی بکنم الان دونه دونه میخونم. Was Obamacare a trick for pumping private insurance companies? The answer is yes. Why there is no rule for public insurance for all like the thing we have in Iran? ببخشید اینو من درست نمیفهمم سوال چیه. Why there is no rule for public insurance like they think. من ایران نمیدونم راستش سیستمش چطوریه. ایران فکر نمی‌کنم universal healthcare داره اصلا یا نداره، نمیدونم.
بله ما یه بیمه تامین اجتماعی داریم که مثلا همه عضوان توش و تامین اجتماعی هم مراکز درمانی داره تو هر شهری یا بعضی اوقات تو روستا که مثلا همه دیگه از خدمات بهداشتی بهره مند میشه.
درسته. تو آمریکا هست تا یه حدی، مثلا پابلیک هاسپیتال وجود داره ولی بودجهشون همیشه در فشاره و تعدادشون هم داره کمتر و کمتر میشه. خیلی سیچویشن واقعا سستینبلی نیست. یعنی it's not a holistic solution. It's a very, it meets a certain community needs, but there are long wait times and it's just grossly inadequate. I'll just leave it at that. So my activism is really about, we know what the solution is and we just have to do it. So it does exist. It's just very extremely limited. Let me move on to the next question. How ordinary people can help to move legislation towards having a single payer system? You're preaching to the choir. Contact me. We'd love to have you. I won't go through all the things that we're doing, but we have been pretty active this year with a group of constituents here strategizing. And our number one priority right now is that petition that I posted there. And if it's okay, I'd love to put it on the chat, but I don't think I have access to the chat. And that's one way we can put a little bit of leverage on our congressperson. That may not be obvious to some of you, since many of you get petitions all the time. You might think it's a small thing. And believe me, I'm one of those people who think petitions are not nearly enough to get anything done. But I can talk to you offline if you're interested about what's so strategic about this particular one. The next question I'm seeing is, within the current system, there is cost of time people spending fighting the insurance companies for the care they need but are denied. That cost has to be added to the savings of Medicare for all. Absolutely. Many doctors are now increasingly in favor of Medicare for all because they're tired of dealing with the insurance companies. They would rather take a pay cut, quite frankly, which, by the way, they wouldn't under Medicare for all, and there's analysis on that as well if you're interested. But they would rather not have to hire staff they don't have to hire the staff to deal with the paperwork. But more important than that, there's been some surveys done of both nurses and doctors, but doctors especially are one of the most burned out people in our society. And a lot of it is just dealing with things that are non-healthcare related. Most people, I don't have any connections to the healthcare system professionally, but I would think most people who went into healthcare to help people. And they didn't go into healthcare to do paperwork. And that's what our system has come down to, unfortunately. So that's a very, very good point. Open to more questions. By the way, I love questions. And if I can answer them, I'm happy to say I don't know the answer.
ما یه توصیه دیگه از نظر how can ordinary people move legislation forward. تجربه من فکر کنم تجربه خودت هم همین شاید باشه. Personal stories make a difference. Right? تا اونجایی که میتونین داستان خودتون رو بگین، سختی‌هایی که خودتون کشیدین، برخوردهایی که خودتون داشتین با هلت کیر سیستم و اثری که رو زندگی شما داشته، اگه بتونین این موضوع رو توضیح بدین و با عکس و نامه و این چیزا با سیاستمدارا آدم برخورد بکنه، بهتون قول میدم اون اثر 1000 تا پتیشن سیگنچر داره. واسه اینکه اصلا به اون موضوع برخورد میکنن، سیاستمداران بالاخره مادرن، پدرن، برادرن، خواهرن، اونام یه جوری تحت اثر قرار میگیرن و میدونن که شما فقط یه نظر سیاسی و یه موضوع سیاسی رو عنوان نمیکنین، یه موضوع شخصی عنوان میکنین و میدونن اثر این تو میدیا چی خواهد بود. این توصیه من از نظر یه کسی که دارم
I'm happy to report that all of the above has been tried. You know, sad stories, there are plenty of sad stories. People, in fact, I was in a meeting with Scott Peters in 2019, and we had 3 or 4 people go one after each other.
Yeah.
And then, you know, you want to do a little bit of both, because you want to say that you're not just, the good thing about Medicare for All is it's correct on a moral ground, and it's also correct on a fiscal ground, on an economic ground. Right. And what I found actually with people who, it's not, you might be thinking that it's a case of convincing them. It's actually less about convincing them. It's about their, where they're, who's holding the levers of power. I think that's really what it comes down to. And if you are primarily, and I'm not picking on my own congressman, because he's not unique. That this is a problem with our society, because we have legalized this idea of unlimited campaign finance. So you have to understand who they are responsive to. They're not responsive to, unfortunately, many of them are not responsive to their own constituents. And this is something that, to the degree that we constituents can bring that to light and can tell them, no, we do matter, and we have a way to hurt you. And the way we hurt you is by bringing light to what you're doing.
Right.
And I think that's actually more effective, because it's really a power game.
Right.
And so what I would like to do personally, it's almost not even about healthcare. It's about restoring democracy, and it's about this idea of you have to be responsive to your constituents, because if we let this go, if we say, no big deal, my insurance is fine, my healthcare is fine, I'm wealthy enough, you're basically forfeiting an important part of democracy. They're going to feel more and more insulated from their constituents, because they can get reelected because they have so much money that they could put ads out and just deceive everybody. And unfortunately, that's the game that's being played.
Right. So campaign finance reform may be another topic for Anjuman to consider, because that is a gigantic topic. Mazdak, sepasgutarim. Thank you so much for your time, for your expertise, for your activism. I think we've all learned a lot. We can refer to your article in PAIC in Farsi and English to see the whole story. So اگه سوال دیگه نمیبینم، این به پایان برنامه ما امشب میرسه. مازدک اگه حرف آخری، توصیه آخری داری, we'll take it. Otherwise, we're going to conclude the program.
No, I just really, from the bottom of my heart, I want to thank AIEP for giving me this opportunity. You know, I don't see myself as a presenter type, so I'm really glad that you given me this platform and this opportunity. And thanks again for your time in listening to this.
You did very good. You did very good.
خیلی ممنون.
دوستان شب بخیر.
شب همگی بخیر. خیلی ممنون.